On the morning of June 24, 1998, Kathleen Grundy, 81 years old, a tireless advocate for the elderly, a woman who still walked daily and ran charity events in her community, opened the door of her cottage in Hyde, Greater Manchester to a man she trusted completely, her doctor. Harold Shipman had been her GP for years. When he suggested a routine blood test that morning, she didn't question it. She sat down, she rolled up her sleeve, and the man she trusted more than almost anyone injected a fatal overdose of diamorphine into her vein. Kathleen Grundy died within minutes. Dr. Shipman recorded the cause of death as old age. Then he sat down at his typewriter and forged her will, leaving her £386,000 estate to himself. What Shipman didn't know was that Kathleen Grundy's daughter was a solicitor, and when Angela Woodruff saw that will, she knew immediately it was not her mother's signature. This case should have been discovered years earlier. The body count was already staggering, but nobody was looking, because the killer was the one person everyone was conditioned to trust. At least 215 patients, possibly 250 or more, over the course of 23 years. Harold Frederick Shipman remains the most prolific serial killer in British history and the only doctor in the United Kingdom ever convicted of murdering his own patients. He didn't kill in shadows, he killed in broad daylight, in examination rooms and living rooms, between the hours of 1 and 5 in the afternoon, with the families of his victims, sometimes in the next room. The official inquiry, led by Dame Janet Smith, would later conclude that Shipman probably began killing within a year of leaving medical school. For 2 decades his patients smiled and thanked him as he ended their lives. The question that haunts this case is not what Shipman did, it's how no one stopped him for 23 years. Harold Shipman was born on January 14, 1946, in Nottingham, England. He was known to his family as Fred, a bright, athletic boy who passed the 11+ exam and won a place at grammar school. He excelled at rugby and running, he was intelligent. He was also arrogant, distant, considered by classmates to have few real friends. But the defining relationship of his childhood was with his mother, Vera. Vera Shipman was a domineering woman who instilled in Harold a sense of superiority. He was her favorite, the golden child. On Christmas Eve 1961, when Harold was 15, Vera was diagnosed with terminal lung cancer. Over the months that followed, Harold watched his mother's decline and he watched something else. He watched the family GP arrive at their home to administer morphine. He watched the relief it brought her. He watched her die. His greatest supporter was gone, and the method that would become his signature had been burned into his mind. Shipman entered Leeds University Medical School shortly afterward. He was on a path and no one could yet see where it led. Shipman graduated and took his first position as a junior doctor at Pontefract General Infirmary in 1970. The Dame Janet Smith inquiry would later determine that his first killings likely occurred during this period, within 1 to 2 years of leaving medical school. The exact number from Pontefract is unknown. Smith estimated between 10 and 15 victims, but stressed it was only an estimate. It was also at Pontefract, on the obstetrics unit, that Shipman first gained access to Pethidine, a powerful synthetic opioid. He became addicted. In 1974, Shipman was appointed as a general practitioner at the Abraham Ormerod Medical Center in Todmorden, West Yorkshire. He was well liked by his elderly patients. He made house calls other doctors wouldn't. He seemed caring, attentive, the old-fashioned family GP everyone wanted. But behind that image, Shipman was manipulating the system to feed his addiction. He wrote fraudulent prescriptions. He falsified records. When his colleagues finally discovered what he was doing in 1975, he was fired. He pleaded guilty to multiple drug offenses. He was fined $600. He attended a rehabilitation program. And then, astonishingly, the General Medical Council allowed him to continue practicing. He was not struck off, he was not barred, he was sent on his way. After rehabilitation, Shipman took a position at Donnybrook Medical Center in Hyde, Greater Manchester. He rebuilt his reputation. His patients adored him. He especially treated the older women with gentleness, respect, and a warmth their own GPs had stopped offering. He wasn't just their doctor, he was, many of them said, their friend. And from 1977 onward, that trust became a death sentence. Shipman's method was devastatingly simple. He would visit a patient, usually an elderly woman living alone, and administer what appeared to be a routine injection. The substance was diamorphine, medical-grade heroin. The patient would lose consciousness within seconds. Death followed within minutes. Then Shipman would falsify the medical records. He would invent symptoms, heart conditions, respiratory problems, chronic illnesses that explained a sudden death. He would sign the death certificate himself, and because he was the doctor, because he was trusted, no one questioned it. A later clinical audit by Professor Richard Baker revealed the horrifying scale. Compared to other GPs in the same area, Shipman signed a massively disproportionate number of death certificates. His patients died overwhelmingly between 1 and 5 p.m., what investigators would come to call Shipman Time. And in 1992, when he left the group practice to operate solo out of 21 Market Street, the death rate shot up. He was killing with no one watching. In March 1998, a taxi driver named John Shaw approached the police. He had noticed something deeply wrong. He regularly drove elderly women to Shipman's surgery, and he had observed that 21 of them had died unexpectedly in Shipman's care, despite arriving in apparently good health. He reported his concerns. The police assigned inexperienced officers to the investigation. They interviewed Shipman. He was calm, professional, convincing. The investigation found nothing. Shipman was cleared. 3 months later, he killed Kathleen Grundy. This time, however, Shipman made a mistake. Kathleen Grundy had a daughter, Angela Woodruff, who was a solicitor. When a new will arrived at a local law firm on the very day Kathleen died, naming Dr. Shipman as the sole beneficiary of her $386,000 estate, Angela knew her mother would never have signed it. The signature was wrong. The document was typed on Shipman's own brother typewriter, and his fingerprint was found on the corner of the will. Angela Woodruff went to the police. This time, the investigation was thorough. Detectives exhumed the bodies of Shipman's former patients from Hyde Cemetery. Forensic pathologists found traces of diamorphine in tissue samples. The computer records Shipman had falsified were reconstructed by police experts. The keystrokes, the timing of the entries, the fabricated medical histories were all laid bare. The doctor who killed with a needle had been undone by ink, paper, and a daughter who refused to look away. Harold Shipman's trial began in October 1999. It lasted 52 days. He was charged with 15 counts of murder and 1 count of forgery. It was only a tiny fraction of the actual death toll. Shipman spoke only 3 times during the entire trial to confirm his name, his age, and his address. He showed no remorse, not a flicker. His wife Primrose sat beside him every day, loyal to the end. On January 31, 2000, the jury returned a guilty verdict on all counts. Justice Thane Forbes delivered a sentence that has become one of the most quoted passages in British criminal history.
I have no doubt that your victim smiled and thanked you as she submitted to your deadly administrations.
Life imprisonment, whole life tariff, he would never be released. The public inquiry that followed, chaired by Dame Janet Smith, spent years reconstructing the true scale of the horror. The final estimate, at least 215 victims, probably closer to 250, spanning a quarter century. Smith's reports exposed catastrophic failures at every level. The police investigation that cleared him, the General Medical Council that allowed him to keep practicing after a drug conviction, a cremation certification system with no checks, a death certification process that no one monitored. Shipman hadn't outsmarted the system. The system had simply never been designed to suspect a doctor. Harold Shipman did not serve his sentence. On the morning of January 13, 2004, the day before his 58th birthday, guards at HMP Wakefield found him hanging in his cell. He had used bed sheets tied into a noose. He had hidden himself behind a curtain. Only an hour earlier, a routine check had found everything normal. The suicide devastated the families of his victims. They had waited for answers they would now never receive. Many believe Shipman had chosen his moment deliberately, to die before his 60th birthday, triggering a clause in his NHS pension that gave his widow Primrose a $100,000 lump sum and $10,000 per year for life. If he had lived past 60, she would have received only half that. The Shipman case changed British medicine permanently. The Shipman effect entered the lexicon, a documented phenomenon in which doctors became afraid to prescribe opioids, even to terminally ill patients in genuine pain, for fear of investigation. New safeguards followed: death certification reform, controlled drug monitoring, regular GP appraisals, mandatory revalidation of doctors. But the deeper wound was to trust itself. Shipman had exploited the most fundamental relationship in medicine, the bond between doctor and patient. He had weaponized care. The patients who died in his hands believed, until their final moments, that they were being healed. And for every new safeguard put in place, the question persists: what do we do when the monster is the one wearing the white coat? If you want more scary stories like this about the terrors of the darker side of humanity, then please subscribe and stay close. And don't forget to follow us on social media for the latest images, clips, and updates.